The 7 mysterious smells that reveal Alzheimer's before doctors. Have you ever smelled a strange smell that no one else can detect? Is your nose trying to warn you about something much more serious? Is there a hidden connection between these ghost scents and the future of your mind? Millions of Americans experience changes in their sense of smell every day, without knowing that they may be facing the first signs of Alzheimer's. Medical science has discovered surprising connections between the olfactory system and brain health. Recent studies from the University of Chicago reveal that changes in smell can appear up to 20 years before the classic symptoms of dementia. Your nose may be the earliest warning system you have, but how to distinguish between a common cold and a neurological alarm signal? The answer may lie in the specific types of smells you experience. Mayo Clinic researchers have identified distinct patterns that deserve immediate medical attention. Let's get started. 1. How your nose can reveal the future of your brain. The human olfactory system connects directly with brain areas responsible for memory. This unique connection makes smell an early indicator of neurological changes. Unlike other senses, olfactory nerves reach the brain directly without passing through filters. The hippocampus and amygdala, crucial regions for memory and emotion, receive olfactory information immediately. When tau and beta amyloid proteins accumulate in the brain, these areas are affected first. The result is an alteration in the perception of smells long before any memory problems. Scientists at the University of Pennsylvania have demonstrated that olfactory nerve cells die years before other neurons. This degenerative process begins in the olfactory bulb, a structure the size of a pea. From there, the degeneration gradually spreads to other brain regions. Longitudinal studies have followed patients for decades and confirmed this progression. People who developed Alzheimer's showed olfactory changes 15 to 20 years before diagnosis. This discovery revolutionized the understanding of early detection of the disease. Smell tests are now part of screening protocols in specialized centers. But you can spot suspicious signs long before any medical examination. The key is to recognize specific patterns that are out of the ordinary. Get ready to discover the 7 most revealing smells your mind may be producing. 2. The first sign that doctors ignore. Anosmia, or partial loss of smell, is often dismissed as a minor symptom. Doctors traditionally associate this problem only with colds or seasonal allergies. However, the gradual and persistent loss of smell may indicate progressive neurological degeneration. Unlike temporary anosmia caused by infections, Alzheimer's-related loss is subtle and constant. You may not immediately realize that you are losing the ability to smell. The brain compensates initially by masking the deficiency through old olfactory memories. Only when the loss becomes significant does the person notice the difference. This brain compensation can delay the identification of the problem for years. Researchers at Columbia University have developed specific tests to detect this early loss. The University of Pennsylvania's smell identification test has become an international standard. It evaluates 40 different odors using micro-encapsulated cards. People with early Alzheimer's consistently score low on these tests. Diagnostic accuracy reaches 85% when combined with other indicators. Women generally maintain a better sense of smell than men throughout their lives. However, they also show a steeper decline when they develop dementia. This gender gap is still being investigated by specialized neurologists. Hormonal factors can influence both protection and olfactory vulnerability. The important thing is to recognize that persistent loss of smell should never be ignored, especially when accompanied by other subtle symptoms that you haven't identified yet. 3. The mystery behind memory and smell loss. The relationship between smell and memory goes far beyond simple association. Specific smells can trigger vivid memories and intense emotions instantly. This phenomenon, known as the Proust effect, demonstrates the deep neurological connection between these systems. In the brain, the primary olfactory cortex connects directly with the limbic system. This area processes both smells and long-term emotional memories. When amyloid plaques are deposited in these regions, both functions deteriorate simultaneously. The loss of familiar smells can precede the forgetfulness of loved ones. Imagine not being able to smell your wife's perfume or the aroma of morning coffee. These smells, once loaded with emotional meaning, simply disappear from perception. The brain gradually loses the ability to form new olfactory memory associations. Old memories linked to smells also begin to fade progressively. Neurologists observe that patients lose first complex smells and then simple ones. Floral fragrances and spices fade before basic odors like ammonia. This hierarchical progression reflects the complexity of the neural processing involved. Neuroimaging studies show reduced activity in the primary olfactory cortex. Simultaneously, the hippocampus has decreased volume and neural connectivity. Degeneration advances in a synchronized manner between these interconnected regions. Experimental therapies try to stimulate the sense of smell to preserve memory. Controlled aromatherapy and exposure to familiar smells show promising results. The goal is to keep neural pathways active while still partially functioning. 4. The ghostly smell that announces danger. Phantosmia is the perception of smells that do not exist in the environment. This neurological phenomenon may be one of the first signs of Alzheimer's. Unlike visual or auditory hallucinations, phantom smells are subtle and confusing. You may smell burning, smoke, or something charred with no apparent source. Family and friends cannot detect anything, generating doubts about their sanity. These phantom smells arise when olfactory neurons fire spontaneously. The brain interprets these anomalous electrical signals as real odors from the environment. Defective tau proteins can cause hyperactivation of specific nerve cells. Clusters of neurons begin to function in an uncoordinated and unpredictable way. The result is olfactory perceptions that do not correspond to external reality. Burning smell is the most commonly reported in the early stages of dementia. It can be intermittent, lasting minutes, or persisting for hours at a time. Some people describe it as smelling like burning paper or charred wood. Others report the odor of molten plastic or overheated electrical wiring. The intensity ranges from subtle to extremely disturbing and nauseating. Neurologists classify these episodes as olfactory dysgeusia when they persist beyond a few weeks. Differential diagnosis includes brain tumors, temporal epilepsy, and complex migraines. However, when combined with other subtle cognitive cues, it points to neurodegenerative degeneration. Anticonvulsant medications can temporarily reduce these phantom smells, but the focus should be on investigating the underlying neurological cause. Don't ignore lingering smells that no one else can detect around you. 5. The sweet scent that hides a silent threat. Sweet and fruity olfactory perceptions may seem pleasant, but they are worrisome. Many people report the smell of ripe fruit, honey, or sweets without explanation. This type of phantosmia is associated with changes in brain metabolism. When neurons begin to die, they release substances that can produce sweet odors. The brain can literally be rotting and generating these phantom scents. Post-mortem studies reveal a correlation between sweet phantosmia and accumulation of toxic proteins. Brain regions affected by Alzheimer's produce specific volatile compounds. These compounds can be detected both internally and by trained dogs. Researchers are developing electronic sensors to detect these olfactory biomarkers. The technology is still experimental, but it promises to revolutionize early diagnosis. In the meantime, you should pay attention to lingering and unexplained sweet smells, especially if accompanied by subtle changes in personality or mood. The smell can come and go, making it difficult to identify consistent patterns. Some people describe it as the aroma of overripe banana or fermented apple. Others report overly sweet flower fragrance or cloying perfume. The perception can be so realistic that you look for the physical source of the odor. This fruitless search generates additional anxiety and confusion about their mental condition. Family members may initially dismiss their worries as imaginary or psychological. However, the persistence of these episodes justifies specialized neurological evaluation. Keeping a detailed diary of episodes helps doctors identify meaningful patterns. Write down the time, duration, intensity, and circumstances of each anomalous olfactory occurrence. 6. The metallic taste your brain is screaming. Persistent metallic taste in the mouth may indicate profound neurological changes. Although technically it is a taste problem, it is closely linked to smell. Taste and olfactory systems process sensory information in adjacent brain regions. When one area is affected by degeneration, the other often suffers as well. People in the early stages of Alzheimer's report a taste of metal, coins, or blood. This phantom taste can persist for days or weeks with no obvious medical explanation. Unlike the metallic taste caused by medications or dental problems, this one is neurological. It does not improve with oral hygiene, mouthwashes, or changes in diet. It may be accompanied by a feeling of dry mouth or changes in salivation. Some patients describe it as if they had licked a battery or metallic object. The intensity varies throughout the day and is often worse in the morning. Neurologists associate the symptom with facial nerve dysfunction and glossopharyngeal nerve. These cranial nerves are affected early in neurodegenerative processes. Neuroimaging tests show reduced activity in taste areas of the brain. The insular cortex, responsible for processing flavors, has structural changes. These changes can occur years before overt cognitive symptoms. Some studies suggest a correlation between the intensity of metallic taste and disease progression. Patients with more intense ghost flavors tend to develop dementia more quickly. This observation still needs to be confirmed through larger longitudinal studies. Meanwhile, persistent metallic taste merits specialized neurological investigation, especially when combined with other sensory signals you're discovering here. 7. The disgusting odor that no one else smells. Unpleasant smells like rotting fish, ammonia, or spoiled eggs are alarming signs. These offensive odors may indicate accelerated neuronal death in olfactory regions. When brain cells die rapidly, they produce characteristic putrefactive compounds. Your nose may be literally detecting the breakdown of the brain itself. This type of phantosmia is particularly disturbing and socially embarrassing. You may avoid social situations by fearing that others will notice the bad odor. In reality, smell exists only in your altered neurological perception. Family members are confused when you complain about odors they can't smell. This discrepancy can generate conflicts and progressive social isolation. Studies show a correlation between putrefactive phantosmia and accelerated cognitive decline. Patients who report these smells tend to progress more quickly to severe dementia. Ammonia odor is of particular concern and deserves immediate medical attention. May indicate accumulation of nitrogenous toxins in decaying brain tissue. Rotting fish smell is associated with neurological inflammation and oxidative stress. These processes accelerate the death of neurons in a destructive cascade. Spoiled eggs or sulfur can indicate changes in brain amino acid metabolism. The perception of these odors can be constant or episodic throughout the day. Episodes can last minutes, hours, or persist for consecutive days. Medications can partially mask these smells, but do not treat the underlying cause. The focus should be on identifying and treating progressive neurological degeneration. Don't hesitate to seek specialized medical help in the face of these alarming olfactory signs. 8. The musty smell that comes from inside. Persistent perception of mold, dampness, or the smell of the basement can be neurological. This type of phantosmia suggests changes in the processing of environmental odors. Unlike real domestic humidity problems, this smell is internal and constant. You can look for leaks, check ventilation systems, and clean carpets to no avail. The problem is not in your home, but in the brain circuits of smell. Musty neurological smell often accompanies subtle personality changes. Patients report feeling blurry mentally, as if there is brain fog. This analogy is neurologically accurate, as it indicates reduced cognitive clarity. The prefrontal cortex, which is responsible for executive functions, may be affected. When this region undergoes degeneration, olfactory processing also changes. Neuroimaging studies show reduced connectivity between olfactory and executive areas. This disconnection results in distorted olfactory perceptions and less clear thinking. People often describe the smell as wet earth or old books. Others report the odor of stored clothes or decaying wet wood. The intensity can vary with factors such as stress, fatigue, and hormonal changes. Postmenopausal women seem more susceptible to this specific type of phantosmia. Estrogen fluctuations can influence both olfactory perception and neurodegeneration. This hormonal connection is still being investigated in specialized longitudinal studies. Meanwhile, persistent musty smell with no identifiable source merits neurological evaluation, especially if accompanied by difficulties concentrating or mood swings. The combination of these symptoms may indicate degeneration in multiple interconnected brain areas. 9. The chemical aroma that reveals the truth. Smells of chemicals, gasoline, or solvents may indicate neurological toxicity. These phantom odors suggest that neurons are being damaged by oxidative processes. Your brain may literally be being eroded by uncontrolled free radicals. Accumulation of toxic proteins generates oxidative stress that progressively kills nerve cells. This process produces chemical byproducts that can be perceived as artificial odors. Some people report a constant smell of paint, varnish, or cleaning products. Others describe the aroma of fuel, rubbing alcohol, or persistent acetone. The perception can be so intense that you avoid using household chemicals. Paradoxically, this can worsen anxiety about the origin of these mysterious smells. Neurologists observe correlation between chemical phantosmia and decline in cognitive tests. Specifically, executive functions such as planning and problem-solving deteriorate more quickly. The frontal cortex, which is vulnerable to oxidative stress, processes both smells and executive cognition. When this region suffers damage, both functions decline simultaneously in a progressive way. Experimental studies test antioxidants to reduce both phantosmia and cognitive decline. Vitamin E, coenzyme Q10, and resveratrol show preliminary promising results. However, these treatments are still experimental and do not replace adequate medical evaluation. The most important thing is to recognize that persistent chemical smells are not normal, especially when accompanied by difficulties with concentration, memory, or decision-making. This combination warrants specialized neurological research as soon as possible. The earlier the diagnosis, the greater the chances of effective interventions. 10. When your nose stops working completely. Total anosmia, or complete loss of smell, is the most advanced stage of olfactory changes. When this happens, you can't smell any of your surroundings at all. Perfumes, food, smoke, or even dangerous odors become completely imperceptible. This sensory loss represents extensive death of olfactory neurons and their brain connections. Unlike temporary loss due to colds, Alzheimer's-related anosmia is permanent. Does not improve with decongestants, nasal corticosteroids, or other conventional treatments. It represents irreversible degeneration of the olfactory bulb and primary olfactory cortex. Post-mortem studies confirm severe neuronal loss in these critical brain regions. Patients at this stage often present with overt cognitive symptoms simultaneously. Recent memory loss, temporal disorientation, and language difficulties become apparent. Total anosmia usually precedes the formal diagnosis of dementia by a few years. It represents a crucial diagnostic window that should not be missed by professionals. Family members may notice that you no longer react to familiar or dangerous smells. You don't smell the aroma of morning coffee, your spouse's perfume, or even smoke. This sensory loss brings significant practical risks to home security. Gas leaks, spoiled food, or fires can go completely unnoticed. Environmental adaptations become necessary, including additional smoke and gas detectors. Food labeling with expiration dates becomes essential for food safety. Despite total olfactory loss, neurological interventions can still slow cognitive progression. Medications such as donepezil and memantine can preserve other brain functions for years. The important thing is not to give up even in the face of complete sensory loss. 11. The exact time to act before it's too late. Recognizing when to seek medical help can make the difference between early and late diagnosis. Any olfactory alteration that persists for more than 2 weeks deserves specialized evaluation, especially if accompanied by subtle changes in memory, mood, or personality. The ideal time for intervention is when symptoms are subtle, not when Waiting for overt symptoms means losing precious years of functional neurons. Family doctors may not recognize the importance of seemingly minor olfactory symptoms. Look for neurologists or geriatricians who specialize in cognitive disorders and dementia. These professionals understand the critical connection between smell and brain health. Specialized tests include standardized olfactory assessment, neuroimaging tests, and blood biomarkers. MRI can reveal early atrophy in regions vulnerable to Alzheimer's. Positron emission tomography detects accumulation of toxic proteins years before symptoms. Cerebrospinal fluid scans identify specific biomarkers of neurodegeneration. Neuropsychological tests assess subtle cognitive functions that may be gradually declining. This comprehensive evaluation allows for accurate differential diagnosis between various causes of dementia. Different types of dementia require specific and personalized therapeutic approaches. Alzheimer's, vascular dementia, Lewy body dementia have distinct olfactory patterns. Identifying the specific type guides more accurate therapeutic choices and prognosis. Early interventions include lifestyle modifications, nutritional supplementation, and cognitive stimulation. Regular exercise, a Mediterranean diet, and social activities can slow progression significantly. Some experimental drugs have shown efficacy when started at very early stages. Time is your most valuable ally in the fight against progressive neurodegeneration. You possess the knowledge necessary to make informed decisions about your brain health. Use this information to protect your mind and preserve your future quality of life. Your family and loved ones deserve to have you present and aware for as long as possible. The journey can be challenging, but you don't have to face it alone or uninformed. Expert professionals are ready to help when you take the first brave step. Your mind is your most precious asset and deserves the best protection available. Remember that knowledge is power, especially when it comes to preserving your cognitive ability. The future of your mind depends on the decisions you make today about your health. Don't wait until tomorrow to start protecting what matters most in your life. Your ability to love, remember, and be yourself is in your hands now.